T.J. Samson originally opened up for the first patient in September 1929. They had started planning the building and raising of money and so forth, and the Commonwealth Fund of New York gave maybe $100 and some thousand. And then they raised money locally, and how it became known as T.J. Samson Hospital is because he gave the largest single donation, about $25,000, I believe.
Sometime after the hospital was built, then a nurses' home was built to beside the hospital because there was a need for nurses in the community.
Back then, a nurse just about did everything.
So what better thing to do than to have the nurses' home and the nursing training right beside the hospital?
And then in about 1950, they built what we call the West Wing. And then in 1960, they built the East Wing. I came to work on February the 15th, 1968 as the CEO. My first edition opened up in about 1970. See, the people that we were serving, they needed something better than we was giving. It was really a lot of fun from day one.
We do serve the whole community, and they are our family and our friends. They are the people we go to church with. They're people we run into at Walmart. They're people sometimes that you stop and help if they have a tire that needs to be changed.
I know a lot of facilities around the country say that they work in a family environment, but here, every patient that we interact with, we either know them or we know somebody that does know them.
We give people another reason to come to our wonderful community with the type of health care, that we have.
So it's easy for us to achieve, I think, high level quality of care, high level satisfaction. Other areas in the community that we try to get engaged in are places like the soup kitchen, where we're trying to reach populations in the community to make sure that they are getting as many resources as they possibly can to try to keep everybody healthy.
People think that people go hungry in Middle East, they go hungry in Africa, they go hungry in India, but people go hungry right in our backyard, right here.
There have been a lot of changes for good in T.J. Samson Hospital over the years. More specialists, more services.
That now we provide everything we need right in Glasgow. Patients don't have to go away for chemotherapy. They don't have to go away for radiation. They can get everything done right at home.
And it's the kind of health care I'll come home to. I don't have to go somewhere to a specialist. We've got them right here.
We immigrated from India, and the only thing they allowed to leave India with 2 suitcases. They gave us $50 each. That is how much we left India with. We got training here in Nashville. I became surgeon, she became OBGYN, and we settled down in Glasgow. That's where we started our life. It is not just because of our hard work, but it is because of the community. They supported us, our patients and their family supported us, and that's why we are where we are at this moment.
I think part of the reason that we're still sitting here as a rural hospital independent in 2019 is because of our roots. Mr. Joyner and Mr. Trammell, and our CFO was Roy Spencer. All 3 of those men treated this business as their own. I think they all felt like this was home to them.
We started out with a hospital in shambles. The building, equipment, everything was in shambles. And you know what we built? We built a model hospital. Well, I wasn't going to get sentimental. But that's part of the whole story.
So Neil's philosophy is he wants every patient treated like they were his mother.
These are our neighbors. These are our family members. These are people we know, and we want to make sure that they get the best care that they possibly can get. And I think that's really what makes TJ really a differentiator from other places in the country, and even in this region.
It's a comforting feeling to know that it's right outside of your door in this community.
What I value the most in this role is to be a part of a group in a community that believes in taking care of people.
He really wants us to set everything else aside. Whatever ideas that we have, the first question we need to ask is, how is it going to impact the patient?
So that for us, that really is the journey of this hospital, is every decade trying to be better than we were the decade before. And I feel like we've accomplished that with great leadership and great team members and providers over the years. We built a pavilion back in 2012. The goal with that was really to try to transition the way healthcare was transitioning from being an inpatient hospital centric to really outpatient driven.
It's a great place for people to come and see their doctor, receive physical therapy, go to the lab, or even just come and walk around with friends.
We are getting ready to implement and build a hospice home that will be a very special place for people at the end of their life.
People in Columbia, they want their community to have a good hospital. We saw where we might be able to take some of the things that we've been successful with to the people that need health care, just like our folks around here need health care, and the staff there at Columbia has just been, it's been wonderful.
We will move towards more partnerships with the health systems around us to make sure that we create and maintain a high-level standard of care throughout the region. I would say we've had a very successful 90 years, and I would say we easily have another 90 plus years ahead of us.
Happy birthday, TJ.
Happy birthday, TJ.
Happy 90th birthday, TJ.
Happy birthday, TJ.
Happy birthday, TJ.
Happy 90th birthday, TJ.